I'm glad to see you here for today's lecture. We'll be discussing Tiao Xin Tong Fong, a traditional Chinese medicine formula tailored address modern yet often misunderstood condition, fibromyalgia, myalgia in TCM. This overlaps with what we call heartbeat syndrome, a pattern characterized not only by pain but also by fatigue, emotional imbalance, and systemic stagnation. Our goal today is to understand this condition through both model biomedical mechanisms and classical TCM theory, then explore how this formula bridges the two worlds to offer real therapeutic benefit. Fibromyalgia syndrome, or FMS, is more than just widespread pain. It's a constellation of symptoms such as muscle and joint soreness, persistent fatigue, brain fog, or conjunctive issues, mood disorders, and unrefreshing sleep. From a TCM lens, these symptoms resonate strongly with heartbeat syndrome, where there's a disruption of in heart qi and blood flow, often accompanied by liver qi stagnation and spleen deficiency. This overlap makes TCM particularly well suited to approach fibromyalgia holistically, targeting both physical pain and emotional exhaustion. From a biomedical point of view, fibromyalgia involves central sensitization, meaning the brain becomes overly sensitive to normal sensory signals. Minor discomforts are perceived as pain. Research has also shown low level of serotonin and dopamine, key neurotransmitters for pain control and mood. HPA acids dysregulation affecting stress responses and hormone balance. Invalid inflammatory marks like IL-6 and TNF-alpha, even without clear infection or trauma. This reflects a dysregulated system, not a localized disease, which aligns closely with how TCM views chronic B syndrome that affect the entire body and the mind. In traditional Chinese medicine, heartbeat doesn't mean heart disease in the Western sense. It refers to a pattern where the heart lacks sufficient qi and blood, leading to poor circulation. The shen, spirit, shen, becomes unsettled, causing emotional distress. Philogen and stasis obstruct the meridians, resulting in chronic pain and fatigue. Heartbeat is often seen in individuals who are sensitive, emotionally reactive, chronically stressed, or recovering from prolonged illness. The pathology typically spans the heart, liver, and spleen system, which explains the complex symptom picture of fibromyalgia. Before Tiao Xin Tong Fong can be, several classical formula laid the foundation. Gui Pi Tang to nourish heart and spleen qi and blood, ideal for fatigue, palpitation, and poor memory. Yue Ju Wan to free qi stagnation, especially when triggered by emotions. Zhen Zhu Mu Wan to anchor yang and calm the shen, used for anxiety and sleep problem. But modern patients often present with multiple overlapping patterns. That's why we need formula like 调心通必方 formula that integrate tonification, regulation, and the spirit calming effect all in one. 调心通必方 is a modern integrative formula that draws from classical prescription but adapts them to contemporary needs. Its name 调心 regulate the heart, and 通必 unblock B reflects its dual purpose. First, to soothe the spirit and restore emotional resilience. Second, to unblock qi and blood, relieving pain and tension throughout the body. It's especially helpful for patients with pain plus fatigue, mood disorder plus muscle tension, or stress related inflammatory syndromes. The inclusion of herbs like 灵芝 for immune modulation shows how the formula address inflammation, immunity, and spirits all at once. Let's look at how the formula is constructed. We begin with qi and blood tonics, such as 黄芪、人参、当归, and 熟地黄, build foundational energy and improve circulation. Next, we have sprint calming herb, including 茯神, 酸枣仁, 远志, and 灵芝, help calm the shen, support sleep, emotional resilience, and cognitive clarity. To address liver qi stagnation, we use 柴胡, 香附, and 苍术. This regulate qi, ease tension, and improve digestion. To clear heat and calm the wind, we include 栀子 and 珍珠母, especially help in anxiety, palpitation, or restlessness. And finally, 炙甘草 harmonized the entire formula. Modern science supports many of these herbal actions. 黄芪 and 人参 reduce fatigue and inflammation by enhance mitochondrial function and immunity. 酸枣仁 and 灵芝 regulate the HPA acids, improving sleep and reducing anxiety. 柴胡 and 香附 modulate neurotransmitters like serotonin and dopamine, helping to relieve mood swings and pain sensitivity. 珍珠母 has a calming effects on the central nervous system, reduce sensory hypersensitive. This makes 调心通必方 a unique blend, targeting pain, inflammation, mood, and fatigue in a single prescription. The treatment strategy behind the 调心通必方 is both logical and layered. First, strengthens heart and spleen qi and blood. This helps support the body energy, circulation, and shen. Second, calm the mind and anchor the spirit to relieve emotion tension, restlessness, and insomnia. The third, unblock qi stagnation and restore phylogeny or stasis, treating the physical root of musculoskeletal tension. This formula doesn't chase symptoms, it rebuilds inner order, creating a stable foundation so the body can heal and regulate itself. In clinic, we always adjust based on the patient's presentation. If insomnia is predominant, we may add 合欢皮 or 夜交藤. If pain is severe, 盐湖索and 白芍help relax the muscle and relieve spasm. For emotional construction, 玫瑰花 and 郁金 are excellent for gently soothing liver qi. For chronic fatigue, especially in post-viral cases, 黄金 or 太子参 are added to nourishing qi and essence. This personalization ensures that the formula meets the patient where they are, not just where the textbook says they should be. TCM Classics gave us rich therapeutical backing. In the 锦岳全书, chronic widespread pain is associated with blood deficiency, lead to muscle tightness and a sensation of heaviness. The 素问 highlights the role of qi stagnation, especially emotional qi stagnation, in creating pain and obstruction. Later, scholars like Li Dongyuan described how chronic digestive weakness lead to damn fleas, while Zhu Danxi discussed the link between unresolved emotions and the formation of internal heat and stagnance. Together, this idea helps us see fibromyalgia as a multi-layered symptom, not just about muscles, but about spirit, circulation, and system-wide balance. Let's look at what real-world clinical data shows. A 2022 study from Beijing University of Chinese Medicine found that patients with fibromyalgia who received Tiao Xin Tong Bifang experienced a 40% reduction of pain scores, better sleep quality, especially in deep sleep phases, a lower fatigue level from 4 weeks of treatment. In another trial at Shanghai Hospital, researchers add Lingzhi to the base formula. They measured IL-6 and TNF-alpha levels. Two key inflammation markers are found statistically significant reduction, suggesting that the formula has a clear anti-inflammatory effect. This saying really, when the heart is calm, the shen is stable. When qi flow, pain resolve. This saying is real capture the spirit of Tiao Xin Tong Bifang. When patients comes in not just with pain, but also with mental fatigue, sadness, tension, and confusion, we must treat the whole person. And when we calm the mind, regulate the qi, and nourish the body, the pain truly begins to fade. That's the power of the formula. It helps restore not only comfort, but also clarity, energy, and emotional peace. This brings us to the end of our session. Thank you all for your attention. Now I'd love to hear your thoughts. Have you been